So is Dr. NEET MEHTA is here? Dr. NEET? Okay, so the presentation is Bowman's membrane striae after DSAEK in cases of congenital hereditary endothelial dystrophy, CHED.
Good morning, everyone. Respected judges, I'm NEET MEHTA and I'll be presenting this topic on Bowman's membrane striae following DSAEK in cases of CHED. So I have no financial issue. These are the abbreviations which I'll be using in my presentation. So CHED is a rare autosomal recessive corneal endothelial dystrophy that presents with varied range of corneal haze and opacities, and it can also present with secondary corneal changes because of long-standing corneal edema like epithelial bullae and band-shaped keratopathy. As we know that the DSAEK and PK, full thickness penetrating keratoplasty, these are the two modalities which have been commonly used. While we know that the full thickness penetrating keratoplasty does provide a pristine clear corneal graft, however, it has its downfalls in terms of intraoperative complications, postoperative wound-related and wound dehiscence, and a close follow-up that's required. Contrary to this, DSAEK provides a much safer approach, and these complications are much less in those cases. So because of that reasons, DSAEK has quite often replaced full thickness penetrating keratoplasty in cases of CHED. However, it has been seen that post DSAEK, around a month's time, we can see these folds that are seen over the just above the area of the lenticule that has been placed. So why does these folds occur is the reason why this paper regarding this paper. So here we describe the appearance of these unusual Bowman membrane striae post-operatively after an uncomplicated DSAEK surgery in cases of CHED. So here in our study, we had 99 eyes of 66 subjects of CHED who underwent DSAEK from the year 2008 to 2021. And basically, we divided the patients into two groups, those which showed presence of Bowman membrane striae and those which did not. And we compared the pre and the post-operative findings features in both the groups. So basically, we had the patient demographic data. We graded the corneal opacity subjectively. We measured the visual acuity based on the age-appropriate method, the anterior segment evaluation, intraocular pressure, and fundus evaluation whenever necessary. We also did the biometry, the corneal pachymetry, the densitometry, and the anterior segment OCT in these cases. So this is the baseline characteristics of the patients. Interestingly, what we could see was that the age of surgery was much more than an average of 10.4 as compared to 7 years in cases where they did not show Bowman membrane striae. These were the pre and the post-operative anterior segment imaging characteristics which showed a decrease in the corneal curvature post-operatively, decrease in the corneal thickness, and a much better decreased densitometry. So this is how the normal progression happens. As a pre-operative, which we can see a ground glass opacity and development of these Bowman membrane striae generally around a month's time, and these striae were seen to persist even in the second and the third month's visit. So now coming to why these folds develop and where are they located. So the OCT and the histopathology data in the case of CHED, basically they reveal that these are basically present in the anterior stroma or just at the level of the Bowman's membrane. So typical OCT of a CHED case shows a definite thickening of the stroma, hypertrophy of the epithelium, and multiple irregularities and break at the level of the Bowman's membrane. So these are also seen in the histopathology image of the same thing. However, in cases of CHED, because of the corneal edema, it acts like a pressure and it basically aligns these the Bowman folds and Bowman breaks, and so it appears as if they are pretty smooth. However, once the patient undergoes a DSAEK surgery, the cornea again gets into the relative dehydrated state, and that is when these Bowman's membrane folds get unmasked. So this is the post-operative OCT, anterior segment OCT of the patient, and here we can see that the Bowman's membrane striae, they start at the level of the Bowman's in the anterior stroma, and here we can see that there is back shadowing that is seen. So here from our study, we came to know that the Bowman's membrane striae are typically seen between 3 to 4 weeks post-operatively. They remain unaltered throughout the post-operative course. However, in the follow-up of almost 10 to 13 years, there is a gradual decrease in the density of these folds. Almost 2/3 of the cases that were operated developed these Bowman's membrane fold. the Bowman's membrane striae was limited to the lenticular placement, and so the peripheral cornea appeared to be unaffected, and these did not hamper the functional recovery of the patient. So while DSAEK seems to be a superior option, surgical option in cases of CHED, we need to keep in mind that it lacks a pristine clarity of the graft and as compared to a PK, and 2/3 of these patients can present with such a Bowman's membrane striae. So these are just basically wrinkles that are seen due to the flattening of the cornea, rapid thinning and fragmentation due to the long-standing edema. And late surgical intervention could be a possible risk factor for development of this Bowman's membrane striae. These are the references. Thank you.
Aksha, what was the most important contributory factor to this Bowman membrane striae in your cases?
In our case series, what we found conclusively was the age at which the patient was operated. However, anatomically correlating with it, we were not very sure that exactly whether it is having a possible correlation or not.
So you said that it was age dependent?
Yeah.
Any other factor which contributed to this Bowman membrane striae apart from the age profile of the patient?
Apart from the age, we were not able to find any other factor that could.
What was the follow-up and how long this striae persisted?
Yeah, so the follow-up from 2008 to 2021, so the longest follow-up we had was 13 years. Average follow-up period was 7.5 years, and these developed after around 3 to 4 weeks after post-operatively.
How long it persisted? It was
Around?
how long it persisted?
It actually persisted for even after on the 13th year for follow-up. There were but the density of these striae decreased. But they still persisted in those cases which had it.
You can answer from.
You can keep answering, yeah.
Okay, thank you so much.